So we're going to start by talking about the symptoms and clarity around the symptoms and what it means at Nourish. So symptoms are going to be incredibly important with these policy updates. So first we'll chat about our health check. So when you walk in every day, the parent or the drop-off person fills out the health screening form. There are 3 questions, and any approved drop-off member should be aware of these questions, and you place a check mark next to the statement if it is true. So no fever, that's 100 degrees or higher. No fever should be present in your child. We're not giving Tylenol in the morning to our children who might have a fever. No fever should be present in your child. That is across the board in all communicable diseases, not just COVID-19, no fever. No new cough or shortness of breath. So if your kids have a cough for 3 months, that's different. That's probably an allergy. You should probably have that, diagnosed in another way. But if your child didn't have a cough yesterday and woke up with a cough today, that is a new cough. If they have a cough for a month and it's gotten worse, and I think as a parent, I typically know when the cough has gotten worse, that's important to know, and no shortness of breath, and then no contact with a known exposure of COVID-19 in the last 14 days. And these statements should be marked true if they're true. If they're false, then that's something that you should be coming to talk to Mike and Alex about, or your teachers about, to figure out what the next path forward is.
Yes. So on top of that, temperatures will be continued to be checked daily. So nothing has really changed in this aspect of the fever, but I wanted to just a little clarity around it. So our policy here is that if a child or staff member presents with a fever of 100.0 or above, the child or staff member must be sent home. So that is currently what we have. And right now we have the policy that they are out for 72 hours with a fever. So that is without medication. So if you gave medication yesterday for a fever, but no medication today and there's no fever, then today is day 1, so I just want to make sure that we're clear that it's 72 hours. So the way you can return to Nourish before the 72 hours is if you have a written doctor's note. Then you can return after 24 hours, which was our old policy before COVID. So just clarity, you can return before the 72 hours, but you have to have a doctor's note, and it has to be at least 24 hours since the fever without medication.
Right. So I'll talk a little bit about symptoms for COVID-19, because the fever is not a high-risk symptom for COVID-19, but it's indicating of every other communicable disease that we have. So we are paying attention to fevers no matter what. We always have, we always will. But for COVID-19 in particular, the high-risk symptoms are that new or worsening cough, the shortness of breath, the difficulty breathing, and the new loss of taste or smell. 4 high-risk symptoms for COVID-19. If your child is presenting with any of those, or if a staff member is presenting with any of those, they cannot come to Nourish. They cannot. Even with 1, they cannot come. Low-risk symptoms includes chills, fatigue, which kind of go with a fever, muscle, body aches, headache, sore throat, congested or runny nose, nausea or vomiting, and diarrhea. These are things we're looking for daily. They always have been. These are things that if you have any 2 of these, your child will be sent home. So that's 2 low-risk symptoms or 1 high-risk symptom. Your child will be sent home with those symptoms. So what we've decided to do is closely follow the school nurse algorithm that is on the Toledo-Lucas County Health Department website, and it states it very clearly of what to do if these symptoms present. So we'll talk about that in a minute. But all of our teachers are trained in communicable diseases. They know how to screen for these things. This is not a COVID-19 specific training. This is something that we're all trained in and we know